Examination of the venous disease. In this few minutes, we will discuss about the surgical anatomy which is important regarding the varicose vein, deep vein thrombosis. Then what will be the important history that is required for diagnosing a venous disease. Then to examine a venous disease, we will divide the component into inspection, palpation and auscultation. So starting from the varicose vein, first of all we should know that what are the different types of vein in the limb. Usually the lower limb, it is divided into superficial vein, deep vein, and the connection between the superficial and deep vein is via the perforators. And when these veins become dilated, elongated and tortuous, they are called as varicose vein. Okay, so the connection between the superficial vein and deep vein is the perforator, and there are different types of perforator in the leg. Usually in the proximal, it starts from the saphenofemoral opening. Okay, saphenofemoral opening is actually situated at 4 centimeter lower and lateral to the pubic tubercle. Okay, from saphenofemoral junction, while coming down, the first perforator is in the proximal thigh, and that is called as Hunterian perforator. Hunterian perforator. Then while coming to the distal part of the thigh, the other perforator is present, that is called as Dude's perforator. Then in the knee, around the knee, there is below to the knee there is Boyd's perforator, and there is 3 groups of perforator called as caquet perforator in the calf muscle or the distal 1/3 of the leg. Okay, so these are called as caquet perforator. And around the ankle, when coming to the ankle, there is one more type of perforator called as May perforator. So these are the different perforator starting from the saphenofemoral junction, which is situated just 4 centimeter below and lateral to the pubic tubercle. Then in the proximal thigh there was Hunterian perforator. Distal thigh में क्या है तो Dude's perforator. And then around the just below the knee there is Boyd perforator, and in the distal 1/3 of the limb, which is the most common site for the varicose vein, even the ulcer site is also this is the main ulcer site, which is the caquet's perforator, and around the knee the perforator is called as May perforator. Okay, so now according to the definition, the varicose vein is the dilated, elongated and tortuous vein. Okay, and there is 2 modality of classifying the varicose vein. According to the vein involved, it can be long saphenous vein varicosity or short saphenous vein varicosity. It can be perforator vein varicosity, or there is 2 different types according to the size of the vein varicosity. Means around the knee, a very small type of varices can be seen, which is called as thread veins, and if it is about 0.5 to 1 centimeter, 1 mm. Okay, this is the size of the thread vein, whereas reticular vein is somewhat larger than the thread vein, and usually about 1 to 4 centimeter. So this was one classification of the varicose vein. Then the second classification can be either morphological type of varicosity, primary varicosity and secondary varicosity. Morphological varicosity is seen in those person who have to stand longer. Okay, stand usually seen in the जीप ड्राइवर और द ड्राइवर्स. ओके, इरेक्ट पोजीशन में जिसको ज़्यादा देर रहना रहता है, erect position. Okay, and the primary, because there is no underlying pathology, but varicosity has originated. It can be either congenital or weakness of the muscle, wasting of the muscle can result, and due to stretching of the deep fascia. Okay, these are some of the cause for the primary varicosity, means there is no any venous disease present. Stretching of fascia. Then the secondary varicosity is due to underlying any disease, means there can be DVT present, hormonal cause can be there can be AV fistula. So these were some of the cause for the secondary type of DVT. And as I said earlier, some of the risk factor in the varicosity will be prolonged standing, obesity, pregnancy, old age, athletes. And what will be the clinical presentation of DVT? The presentation will be tired and aching sensation, dragging type of pain, heaviness in the leg, night cramp. Okay, and usually the most common presentation will be just the swelling around the leg with the dilated tortuous vein. Okay, and now the sign about the sign we will discuss in the examination portion. So the next component will be our diagnosis of the varicosity. Actually the diagnosis will be done clinically by examining the venous disease, and then venous Doppler or Doppler scan can be done, venography can be done, and the other modality can be peripheral smear, and blood count is also sent. And ulcer if the varicose vein has resulted into ulcer, then we will send it for the discharge. So venography, duplex scan, and Doppler, venous Doppler, these are the most important diagnostic test. And now the last component is the treatment modality of the varicose vein. For the treatment modality, we will start from the conservative treatment. Conservative में क्या, we will avoid standing को रोको, then crepe bandage or elastic stocking below to above leg. Elastic bandage is done usually below to above. And the other, during sleep, keep the leg elevation of leg is actually and exercise. So these are the conservative management. Then some of the drug like calcium dobesilate can be given, calcium dobesilate. And if we have to go for surgery, there are different modality, means first of all, before going to the surgical treatment, we also have the sclerotherapy. Okay, sclerotherapy में क्या दिया जाता है? There is injection of the sclerosing agent, and actually sclerotherapy, and the sclerosing agent is ethanolamine oleate. Ethanolamine oleate is given. And if this all modality is not sufficient enough, then we will go for the surgical treatment. And surgery में क्या करेंगे? There are different modality of ligation. Ligation can be done for the long saphenous vein, short saphenous vein, or for the perforators. The ligation of the long saphenous vein is also called as Trendelenburg operation. Okay, and the other modality will be stripping of the vein. Stripping of vein can be done, and phlebotomy in some of the cases of the superficial vein, varicose vein, phlebotomy can also be done. Phlebotomy is performed. So to recap the varicose vein, the definition is the dilated tortuous elongated vein, and which is divided into different type according to the vein involved: long saphenous, short saphenous, perforator, thread or retinicular. And perforators, we studied the name of the perforator by Hunterian, Boyd, Dudes, and Cackett and May perforator. Clinical feature, as we saw, that usually they present with the swelling, and there may be dragging and painful, and at last they also may present with the ulceration. For the diagnosis, collar Doppler, Doppler scan, or angiography, venography can be performed. For the treatment modality, there were 4 variants. We started from the conservative method by avoiding the standing, elastic bandage, elevation of the leg above the level of the heart, and exercise. And the other drug can be drug like calcium dobesilate, dobicelate can be given, and the other modality is the sclerotherapy, usually done with the injection of the ethanolamine oleate, and the surgical modality usually includes ligation of long saphenous, short saphenous or perforator vein, with the stripping of the vein can also be done, and in some of the cases phlebotomy is performed. Then the other disease which we will be discussing is the deep vein thrombosis. Actually there are many risk factors for the DVT. They can be either age related, varicose vein, pregnancy, high dose. Means simply we can remember that Virchow's triad is the should be present as the etiological factor for the predisposing factor for the DVT. Okay, Virchow's triad में क्या क्या पड़ता है? Virchow's triad, that it includes stasis of the blood, stasis, hypercoagulability, and the other is the injury to the vessel का injury. So these by any means, if this is occurring, then it will cause your DVT. Usually the main site for the DVT is the pelvic vein, leg vein, and in some of the cases it may also include upper limb, leg or hand. Okay, and the clinical presentation will be the clinical feature of this patient will be swelling, pain, redness, low grade fever can also be there with difficulty in movement, and the sign will be tenderness, swelling, and three important signs which is Homan sign. Homan sign is simply while the patient is sleeping in a supine position, the patient is asked to dorsiflex his ankle joint, and during dorsiflexion there will be pain in the calf muscle, which is the most definitive sign for the DVT. Okay, Homan sign. This is the Homan sign. The other is the Mose sign. And Mose sign is just while palpating the calf muscle side by side, there will be pain in the calf muscle. Side by side palpation of the calf muscle produces pain. Okay, this is a Mose sign. And if there is the other test is like called as Neuhoff sign. Neuhoff sign, and this is the deep palpation of the calf muscle will produce pain in the calf muscle, and this is actually present only in the chronic cases of the DVT. Okay, and for the sign we should also look for the sign of the pulmonary embolism as they present with the chest pain, breathlessness, and hemoptysis. Investigation will again be venous Doppler scanner, venography. And for the treatment modality, again we will divide it into conservatively we will do similar as per the varicose vein. And then the medical treatment. What will be the medical treatment? We will give two types of drug. One is for the anticoagulation, anticoagulant like warfarin and heparin, and the other will be thrombolytics. Thrombolytics will be like urokinase or streptokinase. And at last, if these are not sufficient enough, we will go for the surgical treatment, and surgically we can perform venous phlebotomy can be done, or the modality will be plasma operation or May-Husni operation. Plasma operation or May-Husni operation. So these are the three different modality for the surgical treatment of the DVT. Now we will go for the examination portion in case of the varicose vein. Okay, starting from the history. First of all, what would be the relevant history that is required in this patient? Usually they comes with the clinical presentation or the complaint of swelling, pain, ulcer or pigmentation around the skin. Okay, so relevant all the important history. Suppose that there is swelling, then we will ask for the as we studied in the earlier lecture, that swelling is taken, the history of the swelling is taken by MD Pepsa, which is duration, mode, progression, exact site, and एग्जैक्ट साइड एसोसिएटेड फीचर एंड स्किन ओवरलाइंग द स्वेलिंग. पेन का भी हिस्ट्री लेंगे, एंड देन वी विल फाइनली कम टू द इंस्पेक्शन ऑफ द varicose vein. For inspection we will look for the attitude of the limb, attitude of limb, and then deformity, any deformity is present or not. We will look for the venous system, which vein is affected. Actually this can be localized by, as we know that the long saphenous vein is situated in the medial aspect of the leg, whereas short saphenous vein is on the lateral aspect of leg. And whether the perforator, as I said earlier, the site of the perforators, so we will differentiate whether it is the long saphenous, short saphenous, or perforators. And we will look for the extension of the varicosity, extent of varicosity. Then whether any swelling is present in the swelling, whether it is localized or generalized, because generalized type of swelling is seen in DVT case, whereas localized is the case of the superficial thrombophlebitis. We will also look the skin overlying the varicose vein or the limb, and then we will look for the color around the swelling. Usually local redness is due to the peripheral thrombophlebitis. If there is just the inflammation, then it will be red thrombophlebitis. And there can be, if there is massive DVT, there will be phlegmasia alba dolens, phlegmasia alba dolens in case of DVT. Okay, DVT में. And the other, we will also inspect for the toe for any gangrene or loss of hair. It will be we will look for the, means simply we are looking for the ischemic feature. And one very important cough impulse is seen for the around the saphenous opening, that is called as Morrissey cough impulse. Actually during coughing, if the venous incompetency is present, then during coughing there will be impulse visible around the saphenofemoral opening. Okay, saphenous opening mein there will be visible pulsation called as Morrissey cough reflex, cough impulse. And these are the important signs related to the inspection. Now the main topic is the palpation of the palpation during the varicosity. So the first will be our Brody-Trendelenburg test. Okay, Brody-Trendelenburg, B Trendelenburg. In this patient, actually we will press the saphenofemoral junction just by pressing the, this is the first test we are going to perform, called as Brody-Trendelenburg test. After the patient is in supine position, actually he is in recumbent position, and then we are pressing the saphenofemoral junction. Okay, and after pressing the saphenofemoral junction, the patient is asked to sit down, and we release our hand from the saphenofemoral junction. And in normally if the patient's valve in the venous system is competent or normal, then the blood should not have returned back to the leg. Okay, but if the patency of the valve, this actually shows about the patency of valve, patency of the valve in the vein. Okay, so if the valvular patency is not present, then the blood which have already undergone in the proximal part could not have returned back. So I would repeat this test, like the patient was in supine position, we elevated his leg by closing the saphenofemoral junction. Once we have closed the saphenofemoral junction, then we will ask the patient to sit down, and then we will release our finger from the saphenofemoral junction, and normally the blood should not have returned back to the leg if the valvular patency was intact. But because in varicosity the valvular patency is lost, immediately after releasing the hand there will be again blood filled in the varicose part or the distal limb of the leg. So this is the Brody-Trendle-Endenburg test. The other test is the tourniquet test. Tourniquet test में क्या करते हैं, we apply tourniquet in the actually in recombinant position. Patient is in recombinant position and asked to raise his leg so that the superficial vein का जो blood है that is emptied. Okay, and after the after the blood in the superficial vein is emptied, we will apply tourniquet at different level of the leg. Okay, and once the tourniquet is applied, then if the vein above the tourniquet fills up and below remains collapsed, this shows that the perforator valve have been incompetent. Okay, we are applying tourniquet at different level of the leg, and after elevating the leg, the valve will be, means the blood in the leg will be emptied, and when we will put down the leg, or the patient when stands up, then the blood again returns back, and distal to the tourniquet application the blood will be collapsed, whereas proximal to the tourniquet application the blood will again fill up. So this signifies that there is incompetency of the valve. The other is the Porth test. And Porth test में क्या करते हैं, from the toe to the groin region we will apply bandage throughout the leg. This is Porth test. And from great toe to the groin we applied bandage and asked the patient to move or run for some distance, and the person will not be able to move or walk. Okay, so this is Porth test. The fourth type of test we will be doing is the modified Porth test. Modified Porth test में क्या किया जाता है, the tourniquet is applied at the saphenofemoral junction without emptying the vein. Okay, means in a standing position when the blood is filled in the venous system, we will apply just tourniquet in the saphenofemoral junction, and we will ask the patient to walk quickly, and he will not be able to walk, and there will be very bursting type of pain, and the vein will be distended. Okay, in these cases modified Porth टेस्ट में, Porth में टो से लेके ग्रोइन तक में पूरा बैंडेज किए थे, whereas in modified Porth we applied tourniquet just at the saphenous junction but without any elevation of leg. Okay, and we ask the patient to walk quickly. The other is for the Schwarz test. Schwarz test is very easier test. In Schwarz test we apply with the help of one hand we will apply we will press the saphenofemoral junction. Schwarz test में with the one hand we are feeling the saphenofemoral junction, and with the other hand distal to the saphenofemoral junction we will find out the maximum bulging part of the vein, and just by we will press the distal bulging part and feel the impulse directly going to our next hand which is situated in the saphenofemoral junction. Okay, so this is just for feeling the pulsation back to our saphenofemoral junction when pressed at the distal most bulging part of the vein. Okay, so this shows that there is no patency present in the valve. Okay, so this is the Schwarz test. And there is also some of the, we will also look for the Morrissey cough impulse. Morrissey cough impulse कहाँ देखते हैं, तो that is at the, we will put our hand in the saphenofemoral junction and we will ask the patient to cough, and once during coughing there will be presence of impulse will be felt at the saphenofemoral junction, which shows you that there is incompetency in the saphenofemoral junction. Morrissey cough impulse. So this is for the palpation, and to differentiate it from the DVT, we will perform Homan sign, and the other side will be Muse's sign, in which we will gently squeeze the lower part of the calf muscle side by side, and it will be painful in case of DVT. And now hope sign में thickening and deep tenderness will be elicited by palpating deep in the calf muscle. Means there will be tenderness and tenderness along with the thickening of the calf muscle can also be seen. Okay, so these were regarding the different palpatory method for the diagnosis of the venous disease. Okay, thank you.